Hey, whoa, who's there? Is the thing on? Oh yeah, we're here to do that YouTube video. I think it's gonna be about what people think they want when it comes to physio versus what they really want. Oh yeah, we're doing another video. We got 4 things that we're gonna talk about that we think people need to know about what physio really is. So make sure you tune in the video, subscribe. Here we go. Number 1, assessing. So as physiotherapists, one of the big value adds we have is our ability to assess you and develop a plan and identify a root cause to your problem. So instead of just using all those modalities to mask the symptoms, we're able to identify what is driving the issue and then take the time to be able to put together a plan to get you towards where you want to go. Instead of just using different solutions and throwing it at the symptoms, we're able to identify the root cause and start a plan for you.
Number 2, problem solving. So another thing that we do as physios is we problem solve. So I'll give you an example. So a common scenario that we see is someone comes in with knee pain and we ask them to squat. So they go and squat and it looks something like this. And it's really hip dominant. We ask them why that's happening and they go, oh, maybe I didn't really notice it. And we come to realize that this has been a strategy that they've adopted over years to avoid having knee pain. And so we go, okay, well, how can we use our skill set to help that person figure out a way to start loading their knee, and also a game plan to gradually get them to be able to do something like a loaded back squat with the proper pattern, letting their knees travel forward. Another way that we problem solve is between the actual sessions. So a lot of stuff can happen between a physio session. And oftentimes what happens is maybe there's a flare up. And so our job is to help the client problem solve through that flare up. What happened? Why did it happen? And how can we try avoiding that going forward? So that's kind of what we're doing when we're problem solving. We're figuring out, why is something happening and how can we utilize what we know about, motor learning, biomechanics, anatomy, pain to figure out a solution for that person.
Number 3, planning. So a physio is able to sit down and be able to create a plan for you that both looks at the macro and the micro. So the macro being the big picture. Where do you want to get to? Do you want to get back to running a marathon? Do you want to get back to doing CrossFit? Do you want to get back to lifting your child from the floor? Having that big macro goal is important because it gives you the direction in which you're headed. The micro is now baby steps that are going to get you there. So what's really important is that we have benchmarks along the way that we're leading the client through or leading you guys through so that you can get to that bigger picture goal. Now, like everything, nothing's perfect and there's going to be ups and downs, especially in rehab. And that's the great part about having someone like a physio who can guide you through that process, because when you hit those little bumps, you guys can sit down and problem solve what's been keeping you from getting towards that goal, get you back on track, and make sure that you're headed in the right direction. If you don't have a plan, you're just going to be spinning your wheels in the mud and not move anywhere. So get a plan.
Number 4, coaching. So we like to think of ourselves as a coach for our clients. And what this means is really getting to understand you as a person. What are your strengths? What are your weaknesses? What can we utilize from those to help you achieve what you want to achieve? And so this is in helping you with changing your behaviors, developing habits that are going to ultimately help you reach your goal. And a coach does those things by getting to know who you are as a person. Another aspect of that and of coaching is accountability. So just by having a session and the fact that you're going to have to come in and see us and talk about how things went between the sessions, that has some built-in accountability in there. And so in those ways, we like to think of ourselves as a coach for your mindset, for your lifestyle, and for understanding you and how we can help you get to your goals. So many people and companies out there think and claim that the value of physio is in reducing people's pain. We really believe that this is short-sighted because there's so many other ways that we can help provide value and help you actually make meaningful change in your life, your health, become a more resilient person, and so many things, right? And so that's why we talked about those things that we think, are valuable as physio. Things like assessing you, things like helping you problem solve, helping you plan, and being a coach for you to get you to where you want to be long term and over time. And I think this is something that's very difficult to do because there's so many factors that need to be considered along that journey. And I think that's where the true value of physio is someone who's really good at those things and can help guide you over time to a meaningful transformation that's really gonna help you with your life, not just reducing your pain temporarily.